Greetings from Indian Journal of Anaesthesia. I, Dr. Kiran Mahendru, will present a systematic review and meta-analysis published in the September issue of Indian Journal of Anaesthesia. It is an article on comparison of efficacy of ultrasound-guided erector spinae plane block versus thoracolumbar interfascial plane block in patients undergoing lumbar spine surgeries. Now, managing perioperative pain in context of lumbar surgeries is a complex and challenging procedure. New regional techniques are there, which include the erector spinae plane block and the thoracolumbar interfacial plane block. These blocks reduce the reliance on use of systemic opioids, and they are recommended as a part of enhanced recovery after surgery protocols. They reduce the incidence of perioperative nausea vomiting, provide effective perioperative analgesia, and improves the patient satisfaction. The ESP block can manage analgesia in thoracic, abdominal, or lumbar regions, whereas the thoracolumbar interfacial plane block is described as a method for achieving adequate analgesia in lumbar spine surgeries. RCTs comparing these blocks in lumbar spine surgeries have not definitely established the superiority of one block over the other. Therefore, these authors initiated a systematic review and meta-analysis to address this knowledge gap and ascertain whether either block offers a more advantageous profile concerning pain relief and complications. The primary objective of the systematic review and meta-analysis was to look for efficacy of the block in terms of 24 hours opioid consumption, whereas the secondary objectives were the VAS score and the safety profile of the techniques. It is a systematic review and meta-analysis which followed the recommendations of preferred reporting items for systematic review and meta-analysis, is registered with the International Prospective Register of Systematic Reviews, which included the RCTs that compared ultrasound-guided ESP block and the thoracolumbar interfacial plane block in adult patients undergoing lumbar spine surgeries, published in English, comparing either the classical or the modified technique of thoracolumbar interfacial plane block with the ESP block using any volume of local anesthetic or an adjuvant. The studies that compared either of these blocks with other methods or controls were excluded. The information sources included PubMed, Cochrane Central Register of Controlled Trials, Scopus, and Embase. The study period was from inception till 29th of February 2024. And the search strategy included the keywords like thoracolumbar interfacial plane block, erector spinae plane block, modified thoracolumbar interfacial plane block, spine surgeries, and lumbar surgeries. The statistical analysis was done using Review Manager version 5.4. A fixed effect model was used for meta-analysis of data. A funnel plot was created to explore the possibility of any publication bias. The ROB2 tool was used for the risk of bias assessment in the randomized trials. And to assess the robustness of the meta-analysis, a trial sequential analysis was performed. The primary outcome was the 24 hours opioid consumption, whereas the secondary outcomes were the VAS scores at 1 hour and 24 hours, and any incidence of complications like nausea, vomiting, pruritus, or respiratory depression. Total of 1268 studies were explored, out of which 6 were included for the final analysis. These are the studies which were included. Data from 492 patients, which included 6 RCTs, were included. 2 of the RCTs compared the modified thoracolumbar interfacial plane block with the ESP block, whereas the other 4 compared the classical technique to the ESP block. This is the risk of bias assessment, in which 2 of the studies had bias arising from the randomization process. Now, this is the forest plot for the 24 hours opioid consumption, which was the primary outcome of this meta-analysis. As you can see, in overall analysis of 492 patients, the ESP block had lower 24-hour opioid consumption when compared to the thoracolumbar interfacial plane block. That is, the meta-analysis favors the ESP block. Whereas, as you can see, the funnel plot was asymmetrical, which revealed the presence of publication bias for this outcome. Now, These are the forest plots for the secondary outcome, where you can see that the 24 hours opioid consumption as seen in the oral morphine equivalent, the VAS scores at 1 hour and VAS scores at 24 hours favors the ESP block as compared to the thoracolumbar interfacial plane block. And the forest plot for the other secondary outcomes, which was the adverse events, including nausea, vomiting, sedation, and respiratory depression and pruritus, there was no difference in both the groups. That is the ESP block and the thoracolumbar interfacial plane block. So the ESP block resulted in a lower 24-hour opioid consumption and a lower VAS scores at 1 hour and 24 hours post-surgery compared to the thoracolumbar interfacial plane block. There was no significant differences in opioid-related side effects between the two groups. ESP is an interfacial block that acts on the spinal nerves, dorsal and ventral rami, and has a craniocaudal spread. There is also a spread into the epidural and the paravertebral spaces, whereas the thoracolumbar interfacial plane block targets only the sensory dorsal rami and its branches between the multifidus and the longissimus muscle. The difference in the mechanism can possibly explain the observed results in this study. The thoracolumbar block blocks only the dorsal rami and it provides more focused analgesia, and there is no risk of unintended motor blockade when compared with the ESP block. The trial sequential analysis of this study indicates that additional studies are necessary to strengthen the findings. The magnitude of difference that was seen in the postoperative VAS scores, which was just 0.37 at 1 hour and 0.17 at 24 hours, and the 24-hour opioid consumption, which was an oral morphine equivalent of 2.33 mg, was, although statistically significant, may have a questionable clinical value. Reduction in the 24 hours opioid consumption, which was achieved by the ESP block, did not translate into reduced opioid-related side effects in this group. The limitations of this meta-analysis is that there is a relatively small sample size, there is considerable clinical heterogeneity across the included studies, particularly concerning the nerve blockade and using different drugs for post-op analgesia. There are variations in terms of the drug used, the volume administered, concentrations used, and methods of systemic analgesia. Therefore, to interpret the findings of this meta-analysis with caution and emphasize the need for further research with large sample sizes. Coming to the conclusion, in comparison to the thoracolumbar interfacial plane block, the ESP block has significantly lower 24-hour opioid consumption and lower VAS scores at 1 and 24 hours in patients undergoing lumbar spine surgery. The incidence of adverse effects is similar with both the modalities. Thank you so much.